Hello, I'm Soumit Singhai. I'm a consultant geriatrician with a specialist interest in dementia. So there is a lot of promising research showing that you can reduce your risk of Alzheimer's and other dementias through a combination of simple but effective lifestyle changes. And therefore, by leading a brain-healthy lifestyle, you may be able to prevent the symptoms of Alzheimer's and slow down or even reverse the process of deterioration. So there are 6 important factors for what we call a brain-healthy lifestyle, which are as follows. Regular exercise. So probably the most important non-pharmacological intervention to slow down memory loss and reduce the risk of Alzheimer's and actually improve memory is aerobic exercise such as walking or swimming. From research previously, we've known for many years that in rodents, aerobic exercise can lead to hippocampal neurogenesis, which is growth of new nerve cells in the hippocampus, which is a key area in the brain which plays a critical role in the formation, organisation and storage of new memories, as well as connecting certain sensations and emotions to these memories. More recently, there's been evidence that aerobic exercise can increase brain volume in older adults. And most importantly, there has been evidence that exercise can improve cognitive function. So the benefit of exercise is, of course, in addition to all the other benefits, such as to cardiovascular health and mood. Social engagement. So staying socially engaged may protect against Alzheimer's disease and dementia in later life. So making and developing a strong network of friends is a priority. Brain healthy eating. So eating a brain healthy diet can help reduce inflammation, protect neurons, and promote better communications between brain cells. A healthy diet in this regard would include cutting down sugary foods and refined carbohydrates, avoiding trans fats in fast food, fried and packaged foods, eating more omega-3 fats, and having more of what we call a Mediterranean diet, which means plenty of vegetables, beans, whole grains, fish and olive oil, and limiting processed food in favour of fruits and vegetables. So with regards to vitamins and minerals, folic acid, vitamin B12, vitamin D, magnesium and fish oil may help to preserve brain health. Mental stimulation. So by continuing to learn new things and challenging your brain, it's possible to strengthen cognitive skills and reduce the risk of developing Alzheimer's disease and dementia. So the old adage, use it or lose it, really does apply in this situation. So quality and quantity of sleep is important. So the right amount of quality sleep, which is uninterrupted, can help flush out brain toxins and avoid the build-up of damaging plaques. And quantity of sleep and quality are both very important. Interestingly, too much sleep has been shown to have a negative effect on memory. And those who sleep for more than 9 hours at night have an increased risk of both dementia and Alzheimer's compared to those who sleep for 6 to 9 hours. Therefore, one should aim to get the right amount of recommended sleep for their age. So what's recommended is 7 to 9 hours for adults aged 26 to 64 and 7 to 8 hours for people aged 65 and older. And as mentioned already, the quality of sleep is important, and sleep interruptions can have a negative impact on brain health. In fact, people who have restless sleep with fragmented sleep during the night have a higher risk of cognitive decline than those who sleep uninterrupted throughout the night. And there are various sleep trackers available on the market these days to help determine how much sleep you're really getting each night. Stress management. So chronic or persistent stress has a negative impact on the brain, leading to shrinkage in a key memory area which is called the hippocampus and increases the risk of Alzheimer's disease and dementia. However, simple stress techniques can help minimize its harmful effects. So stopping smoking is very important. Smoking is one of the most preventable risk factors for Alzheimer's disease and dementia. So when one stops smoking, the brain benefits from the improved circulation almost immediately. Also, good control of blood pressure and cholesterol levels. So both high blood pressure and high total cholesterol are associated with an increased risk of Alzheimer's disease and also vascular dementia. Also important is watching one's weight. So a major study found that people who were overweight in midlife were twice as likely to develop Alzheimer's down the line, and those who were obese had 3 times the risk. So losing weight if appropriate can go a long way to protecting your brain. Moderating alcohol consumption. So while there appears to be benefits in consuming red wine in moderation, heavy alcohol consumption can dramatically raise the risk of Alzheimer's and accelerate brain aging.